name is Dr. Laura Diaz, and welcome to my treatment group video for paraphilic disorders. My client's name is Theo Castro, and his differential diagnosis is pedophilic disorder. The primary diagnostic features are sexual urges, fantasy, or behaviors involving sexual activity with prepubescent children, sexual urges that have been present for at least 6 months, and individuals with these urges must be at least 16 years old and at least 5 years older than the prepubescent child or children. So a little background on my client. His name is Theo Castro. He is 38 years old and he is single and a pediatric dentist. He was arrested and convicted of sexually abusing boys who came into his practice. And these boys were boys that he mentored at local boys club and boys he coached in Little League. The victims' ages ranged from 8 to 10 years old, and this arrest really shocked everyone who knew him because he was considered to be highly caring and supportive of children. He even chose a profession involving care for children, and he had been a Little League coach for many years, as well as a volunteer for the local boys club. Theo relates that he has never been attracted to adult men or women, and when him and his friends were going through puberty, he never he shares that he never felt the attraction for girls the way his friends did, and this made him feel isolated and confused. But he does admit that during his adolescence, he was aware of an undeveloped attraction towards other boys, and he even experimented with mutual masturbation. But as he grew into manhood, even that attraction went away. His first sexual experience was when he was 8 years old with a 16-year-old swimming coach when he was sexually molested in the pool locker room. But he does not experience this as having been molested. He did. He shares this encounter with a smile on his face and with fondness in his voice and his words. In the past, he did explore occasionally in sexual encounters, but as he grew older, he was surprised to see that his sexual attraction was still with younger boys, usually the ages ranging from 6 to 10 years old. Even when he would masturbate, he would fantasize about boys in that age group. And a couple of occasions, he even, over the years, he really believed that he was in love with the boys he would victimize. So he knew that his friends wouldn't approve of his sexual preference for younger boys, but he never believed that he was doing anything wrong. He believed that when he sexually molested the young boys, that they were sharing a pleasurable experience. He didn't see it as anything wrong because, like in his own words, he said, "It didn't hurt me, so I know I'm not hurting those boys." He did claim that he longed to have the same feelings towards women. So for the multi-axial diagnosis, for axis 1, it's pedophilic disorder. For axis 2, none. For axis 3, none. For axis 4, arrested and convicted. For axis 5, GAF is 35. For the theoretical perspectives, biological perspective, neurotransmitter imbalance may explain the compulsive sexual behaviors associated with paraphilic disorders. A deficit of serotonin has been found to be associated with compulsive sexual behaviors. When engaging in paraphilic behaviors, dopamine is secreted, which results in a pleasure response, making the paraphilic behavior more likely to reoccur. This is also an excess of norepinephrine presented in individuals with pedophilia disorder. And behavioral perspective. Paraphilic disorders may develop because of faulty learning experiences. Sexual arousal is considered to be an involuntary bodily response. This represents a stimulus or response associated and therefore a faulty learning experience that results in the development of paraphilic disorder. Therefore, the faulty learning experience that results in the development of paraphilic disorder is classical conditioning. He makes a stimulus response connected between his involuntary bodily response of sexual arousal when it comes to being in contact with young children. Once that learned association becomes established, the man becomes sexually aroused with young children. Another faulty learning experience that enters the picture is sexual arousal is an experience that feels good. It brings about a pleasure response. So every time the man becomes sexually aroused at seeing young children, he feels pleasure and therefore he is positively reinforced. Thank you.